Okay, welcome everybody to this webinar hosted by GPRA. I'm Dr. Karyn Matterson, the GPRA President, and we've got Dr. Balasubramanian here who is part of our RLA team. Our webinar tonight is on our new national terms and conditions for the employment of registrars over the period 2025 and 2026, otherwise known as the NTCER. So before we get started tonight, I'd like to acknowledge the traditional custodians of the land on which we meet today, wherever we might be across Australia, and honour the First Nations elders and leaders that are past, present and emerging here tonight. Thank you very much for giving up your time. We are very pleased to present to you the NTCER and some of the key aspects of our revised agreement going forward. So the objectives here is to, as I mentioned, to highlight the key changes, explain how it applies to yourself, and equip you with the knowledge for your minimum entitlements going forward from semester 1, 2025. So first up, this year's review saw historic wins for GPRA members. It was a negotiation between GPRA and GPSA, and I'd like to personally thank the negotiating committee, Sama, who is here tonight, Dr. Asanga, Abakun and Dr. Angus Taylor. I'd also like to thank all of our stakeholders that gave us feedback originally a number of months ago, and our working groups that gave of their time as well to inform us moving forward prior to our negotiating committee being formed. So broadly, the overarching principles on the NTCER were that our team, GPRA, were focused on improving attraction to this best specialty that there is, the specialty of general practice and rural generalism. We wanted to increase attraction by increasing our base rate, especially for GPT-1, remove the dreaded 13-week minimum billing cycle, and strengthen the NTCER insofar as the dispute resolution, fatigue management and educational release entitlements, to name a few. We'll go into more depth with a number of those entitlements and clauses that have been strengthened. We particularly, at this juncture, I'd like to say a special thank you to our CEO, Joanne Chapman, who worked tirelessly with our lawyers holding Redlick to help us craft and draft and check and double check and triple check the requirements for the NES, the National Employment Standards, and to make sure that our asks were in line with Fair Work Australia and the Fair Work Act. This is really what drove home the change from the 13-week minimum billing cycle to make it 4 weeks minimum now, which is actually, as I mentioned before, a historic win, which means more money in each of your pockets every payday. As I mentioned before, the NTCER will continue to apply to registrars on the AGPT pathway. However, we will flag that we have put forward, and GPSA have agreed to advocate for us for the NTCER to apply to numerous different pathways. So we're hoping going forward, our advocacy will continue to encompass work for the independent pathway, FSP, RVTS and RGTS pathways. So key highlights of the new NTCER are, as I mentioned, the minimum billing cycle, reduced from 13 weeks to at least monthly. The base rate increase for GPT-1, CGT-1 registrars, which is essentially an uplift of 7% over 2 years or 3.5% each year for GPT-1. Unfortunately, we were unable to get any uplift for GPT-2, 3 or extended pathways, CGT 2, 3 or extended as well. However, we are confident that that minimum billing cycle change is going to mean a lot more money in those registrars' pockets as well. Our NTCER, which has stood the test of time over many, many years, it's been tested in court, it's trained thousands, tens of thousands of registrars, held them through their training pathway, has now strengthened more. It's contemporary, it's relevant, it's got improved provisions, and it's got greater clarity. We're very proud of the clarity that we've been able to achieve with some of those particularly ambiguous clauses that have been problematic in the past. We looked at fatigue management, as we mentioned, the educational release nuances, leave entitlements, superannuation, dispute resolution, and termination. And again, thank you to our legal team that helped us with this. Okay, as far as the key improvements, the details are put to a greater extent, obviously, in the NTCER. But essentially, when we look at these particular areas, such as fatigue management, the principle is it's a shared responsibility between both the registrar and the training practice. There is an onus on both those parties to manage fatigue and excessive workload over 10 hours. Well, an essential 10-hour break is required, and that 10-hour break has been set as a minimum condition. As far as the educational release, there's more information making it clear about the payment for mandatory training for both full-time and part-time registrars. There is more clarity for the base rate and how the leave is calculated. And there's greater clarity around payment when a registrar is rostered or works on a public holiday. And there is some examples and worked examples for those particular calculations, as well as including those calculations or those examples for superannuation as well. Another key improvement, annual leave. If you are in the same training practice for 12 months, you're able to roll over your annual leave now across the 2 contracts, as long as you've got the same employer. So you're not required to take the 2 weeks leave, so you do get to accumulate some of that leave. And for the first time, the NTCER includes a reference that registrars can ask and negotiate for the payment of study leave as part of their contract. As you all know, GPRA have advocated fiercely for paid parental leave, study leave, and exam leave, along with our base rate parity advocacy pieces. We are pleased to say that there are provisions for improved parental leave and domestic and family leave / compassionate leave as well. There's still more work to do on the dispute resolution, but these pathways have been spelled out so it's clearer, and there's avenues for registrars to have available to them a dispute resolution process. Termination payment, there is an improved termination payment for information for registrars and how that's particularly calculated. One of the key things that came out of our working parties prior to going in to negotiate the NTCER was a query around intellectual property. So we've worked into the new NTCER new clauses clarifying who owns the intellectual property if it's created by a registrar. So that means, for example, if you, during the course of your work, come up with a great idea and develop an app, you own that intellectual property. It's not the practice that owns it. It's actually you are protected to take that forward and claim it as your own. The new NTCER commences from semester 1 next year. Over the coming months, we're working with both GPSA and the colleges to guide the appropriate documentation, information on websites, and the practices through the change management that's needed to implement these changes, particularly and specifically around those minimum billing cycles. And then there'll be further schedules developed for semester 2 when we can apply the NTCER to the FSP, IP, RVTS mouthful, and RGTS pathways. I hope that our colleagues on PEP and FSP do take advantage of the strengthened NTCER and take heart in the principle of protection for all registrars, no matter what pathway you are on and no matter what stage you are at. Website there, and if you need help, there's obviously our inquiries line. And Sama, are you around? Can I see you?
Yeah. Thanks, Karyn. So obviously if you have any questions, please post them in the chat, or feel free to chime in if you'd like to. Now I think there's a couple of really common inquiries that we get, and part of that was around strengthening some of the clauses in the NTCER. One of those is around what to do if I have a problem at my practice. Now, we often find ourselves in situations where there's a communication breakdown between the registrar and the supervisor. There's not variable levels of support or perceived support, sometimes from the college, sometimes from other organisations. So there is a clear pathway around dispute resolution set out in the NTCER that should be followed, because as everyone might remember, the NTCER are the minimum terms and conditions on which your employment agreements are based, currently if you're an AGPT registrar. So this dispute resolution process is worthwhile looking at, because it may not necessarily look like one that's being enacted at your practice if there's a particular issue. The other place, and I've posted a link in the chat for everyone to have a look at the actual document. The other thing to look at is what happens around educational release. So some of our information around educational release has been strengthened, particularly around what constitutes a half day, what constitutes a full day. What do I do if I'm a part-time registrar? How much educational release am I actually entitled to? And it's being spelt out as an equivalent pro rata rate of educational release paid attendance, equivalent to what your pro rata full-time equivalent is in practice. And if you're split between two practices, then the pro rata is split evenly between those two practices accordingly. So it would be worthwhile reading through that. That's going to be a bit confusing for some practices to wrap their heads around, and it'd be worthwhile as a registrar that you've got a good oversight of that.
Great, thanks, Sama. I might just give a plug for support for further NTCER negotiations. If you're on this webinar, or looking at it in the future sometime at your leisure, please consider getting involved with GPRA on our working groups and our committees. We do want to represent members as best we can, and getting as many voices to the table is really, really important for the future of general practice. So thank you very much, everybody. Anything else, Simon?
Yeah, there's a question that Sean has asked, a really good question in the chat about how to consider educational release payment. So Sean said, any clarification regarding payment for educational release days to be calculated separately from percentage billings when calculating pay. So this is the issue of rollover and self-funded educational release. So Sean, that has not featured as of yet in the NTCER, but any registrar is free to negotiate this with their practice. What registrars may choose to do is, I mean, depending on when their educational release is, you may find that you may not self-fund as much with a shorter billing cycle. So the best way to account for that is to negotiate for a shorter billing cycle. But registrars are free to negotiate that. And that's certainly a big piece of advocacy for us over the coming years, is trying to make sure that registrars aren't self-funding educational release, annual leave, etc., which has been the case for a long time, especially for those of you that are on 13-week reconciliation cycles.
Yeah, if you do think of something after the conclusion of the webinar tonight, please feel free to write in to GPRA at that address, and one of the team will get back to you.
And there were a few other pre-supplied questions, Karyn. So there were a few things. One asked about pay criteria for level 2 GPs. Now this is a very specific question referring to either, I believe this person may be referring to level 2 supervision for independent registrars, but I might just answer what it is for GPT-2. So there's no base rate increase for GPT-2s at this stage. Another question was, how does the NTCER fit in with the single employer model currently being trialled throughout Australia? So again, remains to be seen how the two models work together, and there may be a split, as you've already noticed, between those training as rural generalist registrars on single employer models versus those training outside of those models, and both models have their pros and cons. So the NTCER is a different arrangement to that, and what model applies to you will really depend on your individual training pathway and individual circumstances in terms of your location of training. Another question that's been asked is about minimum billing down to 1 month is good, but why not 2 weeks minimum? I think that's a really great question. Now, I think we sort of have to remember the NTCER are your minimum obligations. So there's nothing that stops a registrar and a practice negotiating together for a shorter billing cycle. If anything, many registrars do find that talking about how accounts are processed at the practice already is helpful, because many practices do pay their supervisors on a 1 weekly or 2 weekly basis. The 4-week minimum really arose out of a lot of the legal-led work around how often people should be paid their wages, and consideration that calculation of billings reconciliation, regardless of whether it's considered a bonus or not, must be paid within 4 weeks of being earned. So that's where the 1 month came to. But I agree with you, a focus for future negotiation will be around what that minimum billing period is going to be.
And
Another
indeed,
go on, sorry, Karyn.
And indeed, Summer, it was one of our key points that we mentioned numerous times, wasn't it, in the negotiation process about, well, you know, they're doing the accounts every fortnight, so why not just do the registrar accounts? That was a big push that we had, wasn't it?
Yeah. And I think I mean, you may end up finding that, you know, I mean, we float into what practices and arrangements kind of work for us, but certainly from a cash flow perspective, it is better, I think, to be paid fortnightly on a personal basis. Now, paid exam leave, there was a previous, there was a preloaded question about that. Now, Sean has also asked one. So can you clarify further on the paid exam leave clause? So it is just, you're correct, it's setting a precedent that this can be discussed in negotiations. So from our experience, You know, when we kind of train people to do negotiation, one of the biggest things we find is unless it's mentioned in the NTCER, even if it's a recommended thing to be done, it isn't necessarily discussed. And we know that many practices will base their employment agreements for registrars on the NTCER minimum terms and conditions and actually integrate that into an employment agreement template. They'll use the GPRA one. They may choose to use one from GPSA. So long as that is present in the template, it actually provides a prompt during the negotiation to talk about paid study leave. And it's important, again, we talk in negotiation give and take. So Ling Lee's asked a very good question about how to approach negotiating with a practice. So it's about talking about what can I offer you? What can I offer you in exchange for X, Y, Z? So say, for example, you go to a practice and your personal circumstances deem that, you know what, working the Thursday or Friday evenings in the practice actually works really well for me. I don't hit up the nightclubs anymore. We have a pretty simple home life. I can work Thursdays and Friday nights while my supervisors go hit the clubs up. Might not be a bad idea to offer something like that, knowing a bit about, for example, what hours the practice is open. That might take a bit of the practice load off other people, may also make the practice more willing to offer that to you. So you've got to be a little bit clever around what already happens at the practice. And a useful way to gauge that is sometimes to just have a look at the practice website and you can see what hours they're open and what sort of services they provide at those different hours. Because remember, most people don't really want to work evenings and weekends. And in my experience, where it's been successful for registrars is actually negotiating a bit around these still normal hours, but slightly after hours-ish arrangements.
Yeah, all good tips, Summer. I think it's a really key point of advice to really look at the way that the practice operates on a week-to-week basis and see what fits in with your lifestyle, as you mentioned. See what you can give and then determine what you need to take as well.
Now, there's another question that's been asked. I'm going to just answer that in the chat too. This is from, I'm not sure of your name, but I'm not going to butcher it. So if I'm starting GPT-1 this coming October to 2025, would I follow this new NTCER for base payment? So as per the NTCER, so the terms and conditions in here, in this document that we've shared are the product of the 2024 review, and they'll take effect from the first training semester in 2025 and continue until replaced.
Oh, that's a great question, Lingley. What to look for on site visits when seeing if a practice would be a good match? Personally, a window. No, I think everyone's values are different, aren't they? So I guess where you've worked before, what you've liked, whether it's a lot of people around, whether it's a tea room, whether it's predominantly female or mixture of both. If you're coming into general practice training from the hospital, what were your areas that you really liked in the hospital? Did you like minor surgeries, and is the practice really good at training skin cancer doctors? Or did you like women's health or sexual health, and is it in a particular area that attracts that type of clientele? So there's no hard and fast rules as far as what to look for in a practice. I think it comes down to personal values. I look for places that have inclusive collateral around, whether it's First Nations collateral or other persuasions collateral around. An inclusive practice. It's got diversity, that has an efficient booking system. Ring up and make an appointment and see a GP there. See how you're treated.
Look, I think the only thing to add is, don't question don't second guess your instincts. I mean, there are some people and places that will just give you, well, I don't use this term, but patients use this term, give you the ick, right? So there are some places, and for some reason, it gives other people nice feelings and they like it. And then there are places you will go to and people you'll meet, that just don't gel very well with you. And if you can't quite put your finger on it, it's not worthwhile trying to justify to yourself, I should work here instead of somewhere that's an extra 20 minutes drive or whatever. I would suggest don't sacrifice your training for the sake of a small amount of convenience. Some registrars do that, and we see the consequences of that, which is
Yeah.
both parties being unhappy when they didn't need to be. And you'll find that when you find accommodating places that may not be necessarily the most convenient to get to, or you've got to, drive through a really busy motorway or something like that in the morning, you may well find that it's a much better practice and you're much happier there. Because remember, we're not at the practice for the good times. You're also there when you're vulnerable and distressed about a patient interaction, or you're concerned about a patient situation and you want to get some quick advice about them. You've got to feel safe wherever you go and work. And that safety is not just physical safety, but also your psychological and emotional well-being. And you'll only get that somewhere where you don't get the heebie-jeebies or the ick. The key thing for you is, I always talk about in therapy, you have a tense muscular group in your core and your pelvis. If you're leaning forward in the chair, and your feet are kind of in a bit of a squatting position, may not be the right practice for you because your body is telling you something about how you feel about that place.
The body's in the ick.
And Layla's put a terrific comment in that. She's working in a smaller practice, a little far from her home, but good teaching environment, a good place for GPT-1. That is worth its weight in gold. If it works for you, an extra 15 or 20 minutes, I just acknowledge does make a difference, but sometimes those small sacrifices will pay off in the end, for a better training experience for you.
And I think it's really important to reiterate, especially if you're going into GPT-1 next year. Remember, when you're going around to have interviews with practices, you're interviewing the practice as much as they're interviewing you. Please don't think that you're not entitled to ask questions, to have a look around. You are valuable. As a registrar, you are valuable to that practice, and that practice is valuable to you. It's like it's supposed to be a two-way relationship with good communication and benefits for both. So please remember, when you get into that interview, to ask all of those important questions that is going to mean a lot to you. All right, well, we might call it there, I think, for tonight. Thank you, everybody, for your time and your fantastic questions. And thank you so much, Sama. You are truly a gem, and we are very, very, very lucky to have you and the other RLAs. So, yeah, thank you for everything that you do and still being involved with us. And thank you, GPRA team, for putting this on. See you around, people. Bye.
Thanks very much. Bye-bye.